Welcome to Ask Mo TV. We're here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is vitamin D. What is the function of vitamin D?
Well, vitamin D is probably one of my most important and favorite nutrients to speak about, and its functions are very varied in the body. Most people are aware that we need vitamin D for strong bones and teeth, and vitamin D is actually not a vitamin, it's a pro-hormone, so it works with other hormones. So everything from bone density to blood coagulation to repair of tissues to reduction of inflammation are all essential functions of vitamin D.
What are the results of having a vitamin D deficiency?
Well, vitamin D deficiency, which is defined as having a vitamin D level on blood work below a value of 30. The range of vitamin D, according to most labs, are between 30 and 100 units. But studies of all the vitamin D studies ever done, known as a meta-analysis, has demonstrated that the magic number for vitamin D on blood testing is 75. Many of your doctors will tell you you've got adequate vitamin D when your level is a 30, a 35, a 40, a 50, a 60. It's not until it's about 75. Why should we care? Vitamin D is one of the most important biomarker tests of prediction of disease and disability, which means the lower one's level of vitamin D on blood, the higher the risk of dying of any cause, particularly from cardiovascular disease. So vitamin D is more important as a predictor or biomarker of cause of early death and quality of life problems. It's more important than even cholesterol levels from a cardiovascular perspective. But again, I want to say this and reemphasize the importance of this. Low vitamin D levels predict one's increased risk of dying of absolutely anything, vascular and non-vascular causes of death. The sun and exposing yourself to the sun will never repair a low vitamin D level, given our ozone depletion and sunscreens. There were large studies done on Floridians which showed they were all low in vitamin D. So a nutritional supplement is a must. And it should go further to say that most physicians are unaware how to supplement their patients when they are finding them low in vitamin D. I've heard many of my patients say to me, well, I went to another doctor and they did check my vitamin D levels and they were low and they told me to take vitamin D. But if one's vitamin D levels are actually low on the blood, they need quite an enormous amount of vitamin D. And I only say enormous because it's large by some standards, but a person needs whatever it is they need, their needs. So if you're being monitored by a practitioner who's using blood work, you don't have to worry about becoming toxic in vitamin D. You should much more be worrying about the increased risk of health issues that you'll have by not having enough vitamin D.
What kinds of people or demographics would benefit more from taking a vitamin D supplement?
Well, I think anyone would benefit from taking a vitamin D supplement if they need it. Now, many of you out there are thinking, well, I take 500 units or 1,000 or 2,000 or 5,000 units of vitamin D, so I should be okay. Well, because we are not what we eat, that old adage, we are what we eat, it's not true. We're what we absorb from what we eat or the consequences of what we do not. So just because you're taking a certain nutrient or eating a certain food does not mean you have met the levels that you must meet for reduction of disease risk or for the treatment of any particular health problem. So it's important to get the blood work done and to supplement yourself, in vitamin D's case, with the proper vitamin D supplementation. The blood tests we're talking about are measuring vitamin D3. Store-bought vitamin D capsules and tablets and liquids, you should make sure are vitamin D3 as well. But depending on how low your blood levels of vitamin D are, many people out there will actually need a prescription form of activated vitamin D3, and that's only prescription. And that special form of D3 is not the D3 in health food stores.
Can vitamin D be found in any foods?
Vitamin D is certainly found in foods, particularly fatty foods like fish. But again, the absorption and the balance of vitamin D in the diet may be very precarious and hard to predict. So if one's very much concerned about managing the vitamin D levels, you check the blood against your diet. If your diet is inadequate in vitamin D and or the combination of that and ozone depletion and blocking of certain UV rays from the sun that would normally hit the skin producing vitamin D in the body, there's a problem there. Taking the pill is the simplest solution to it. You definitely can fix your vitamin D with a pill of vitamin D. It just may take a little while to figure out the right dose.
This has been Dr. Michael Wald.